So today's session will be on cardiovascular diseases. Okay, these sessions will not be coming for your examinations. This is just to give you knowledge about certain aspects of disease conditions, system based disease conditions. Okay, to also to understand certain medical terminologies for students who are not from a science or a medical background. Okay, so cardiovascular diseases. What are these? Cardiovascular diseases is a group of diseases affecting your heart and blood vessels. These diseases can affect one or many part of your heart and blood vessels. Okay, a person may be symptomatic, which means based on this disease condition, you will show the symptoms. Okay, you will experience the disease. Physically experiencing the disease is symptomatic or asymptomatic. You may be unwell from inside, but you do not show any physical signs and symptoms, which may lead to late diagnosis. Okay, so cardiovascular diseases could be symptomatic and could be asymptomatic as well. Okay, so the diseases that includes your cardiovascular diseases includes the disease of your heart, your blood vessel issues. Okay, for example, your blood vessels narrows down, narrowing of the blood vessels and other organs throughout your body, heart and blood vessel problems, which a person is born with, congenital heart defects. Okay, congenital cardiovascular defects. Okay, so some kids are born with issues in their heart and blood vessels. Then heart valves that are not working right, which I'll show you an image. Only then you will understand what are valves. Okay, walls of the heart separate the upper chambers of the heart to lower chamber of the heart. Okay, heart has four chambers, two atrium and two ventricles. Atrium is both the atriums are your upper chambers, right and left atrium. Both the ventricles are the lower chambers, right and left ventricles. So there is a valve, a piece of tissue that separates the upper atrium and lower ventricle. So if there are some issues in the valves, definitely that's a heart disease. Okay, then heart rhythms, the way how heart pumps. Okay, uh, that is, if it is, that is irregular, it is called cardiac arrhythmias. Okay, so these the way how the heart pumps, the contractions, the relaxations. Okay, relaxations. Okay, the time space between the contraction and relaxation. Okay, that also is important. So these are some examples, some areas where heart and blood vessels issues can develop. And how common is cardiovascular diseases? It is one of the leading cause of death worldwide. Okay, it's a non-communicable disease, but it's a leading cause of death worldwide. Almost half of the adults in US have some form of cardiovascular diseases. Okay, because almost half of the adults in US come under the obesity category as well. Okay, so obesity, overweight, and lifestyle disorders are some way or the other related to cardiovascular diseases. Okay, it affects people of all ages, sexes, ethnicities, and socioeconomic levels as well. Okay, and 1 in 3 women or people who are assigned female at birth. Okay, because now we have discussions on gender identification. That's why we use these statements like people assigned female at birth, that is a girl child born as girl. Okay, so and in future they may become trans or they may not associate with their given birth gender. Okay, so even women can suffer from cardiovascular diseases, especially post menopause. Okay, just give me a minute, 1 minute. Am I audible now? So, what causes cardiovascular diseases? What leads to cardiovascular diseases? So, cardiovascular diseases can vary depending on specific type. Okay, if it is congenital, the causes are different, the reasons are different. Okay, if it is a lifestyle based diseases like atherosclerosis and all, okay, the reasons, the etiology is different. Okay, for example, atherosclerosis. What is atherosclerosis? Cholesterol, okay, over a period of time, again and again, cholesterol deposits with inside your blood vessels. Okay, blood vessel has a certain area for the blood to flow, but what happens when cholesterol begins to deposit in inside your blood vessel? There is very less area for the blood to flow. This is what we call as narrowing of blood vessels. Plaque built up in your arteries, that is, plaque means this cholesterol along with some cells. Okay, and usually the arteries which usually get afflicted by this plaque is your coronary artery. What is coronary artery? Coronary artery is the blood vessel that supplies blood to your heart. Just like every part in your body, every organ, every tissue in your body requires a blood supply, your heart, which pumps blood to other body parts, heart itself also requires a blood supply, right? So coronary artery are the arteries of the heart. Heart also gets its own blood supply through coronary artery. Okay, coronary artery and periphery artery. Periphery artery are the arteries of your extremities. Okay, so these two extremities means your legs. Okay, lower extremity is your leg, upper extremity is your hands. Okay, so coronary artery, periphery artery, these are the arteries which usually get affected by atherosclerosis. Yes, cardiovascular diseases can be genetic as well. If your family, in your family, your next to kin, like your parents, your grandparents, they suffered from a cardiovascular disease, there are high chances that you will also have the risk factor of getting the same disease in your future. Okay. So coronary artery disease, scarring of your heart muscle, genetic problems, and or medications, these can also cause arrhythmias. Okay. How scarring of the heart muscle happens? If you undergo any myocardial infarction, heart attacks, okay, that could lead to scarring. Some genetic problems like you have undergone some surgery for some genetic problems, that could lead to scarring. Okay. Septal disease, cardiac septal disease, valvular disease by birth. Okay. Using certain medications like steroids, okay, these can also cause cardiac arrhythmias, that is irregular rhythm of your heart, arrhythmias. Okay, irregular rhythm of your heart. Then aging, definitely aging is a main factor. Aging, infections, rheumatic diseases. Okay, these can also called this can lead to valve diseases. Okay, heart valve diseases. Okay, there are four chambers in the heart. These four chambers are separated by valves and septum. You divide the heart in two parts. That is called septum. Septum will divide the heart into left heart and right heart. Valves will divide the heart into upper chambers and lower chambers. Okay. So these are the two divisions that we have in the heart. So what are the risk factors of cardiovascular diseases? First is high blood pressure, hypertension. Okay. If that also like not you're suffering from hypertension for 1 or 2 years, not like that. You have to suffer from hypertension for the past 5 to 10 years at least. That could develop into a cardiovascular disease. Okay. Chronic hypertension, high cholesterol, hyperlipidemia. Hyperlipidemia means high levels of cholesterol in your blood. Okay. Tobacco use, okay, including vaping. Vaping is very common among Gen Zs, okay, including vaping. Vaping also leads to cardiovascular diseases. Then we have type 2 diabetes, okay. Family history of heart disease, as I mentioned earlier, it's genetic. Okay, if you want to know what kind of disease conditions you may suffer from in the future, Just look at your parents, look at your grandparents. Okay, see what kind of disease conditions they were suffering from or they are suffering from. Okay, that is most likely 90% of the cases, most likely that will be your future as well. Okay, so lack of physical activity, having excess weight or obesity, diet that is high in sodium, diet high in sugar and fat, overuse of alcohol, okay, and any misuse of prescription level drugs or recreational drugs, what we call as narcotics, okay, like morphine and all. If you that is substance abuse, okay, drug abuse. Preeclampsia or toxemia, another name for preeclampsia is toxemia. So preeclampsia happens during pregnancy in women. Okay. In yesterday's class, if you have attended yesterday's class, we have discussed this preeclampsia. There will be swelling all over the body, edema, and protein in urine. Okay, presence of protein in urine, and high blood pressure. The combination of these three symptoms, okay, these three situations, when it coexists together, we say the mother is suffering from preeclampsia. Preeclampsia. How does it turn into eclampsia? Just an addition of one more symptom, and that is convulsions, fits. If a pregnant mother gets convulsion or fits, she is now an eclamptic mother. She is suffering from eclampsia. Okay. So any woman who has suffered from preeclampsia or toxemia, okay, she also has a high risk of developing early cardiovascular diseases soon after menopause or around menopause. Gestational diabetes, same diabetes that happens during pregnancy. Okay, when a woman is pregnant during that gestational period, what is gestational period? The entire time when she's pregnant. Okay, soon after delivery, soon after labor, she is no longer in gestational period. Okay, gestation means the time period when you are carrying, or when a woman is pregnant, she's carrying a fetus, a live viable fetus. Okay, so that is the gestational time frame. So gestational diabetes means you are diabetic only during pregnancy. As soon as you're not pregnant, you are no longer diabetic. As soon as you have given birth, your blood sugar levels, everything come back to normal. It will come back to normal. And even before pregnancy, you were not diabetic. But pregnancy led you to be diabetic. So that is gestational diabetes. Okay, so women who suffered from gestational diabetes as well, once they attain their menopause, or they are around their menopause age, they are also at a high risk of developing cardiovascular diseases. Then chronic inflammatory and autoimmune conditions. There are certain autoimmune diseases in which your own body, your own lymphocytes and leukocytes, that is the body's defense system, will go and attack your own body tissues. Okay. And unfortunately, in some situations, your own system will attack your own heart. Okay, your heart tissues. So that is some chronic inflammatory autoimmune conditions. Then chronic kidney disease, always remember cardiovascular system, your cardiovascular system, your heart and the vessel system and your kidneys. Okay, these two systems are like twins. If something wrong happens to any one of them, the other will suffer. If something wrong happens to the cardiovascular system, your kidneys will suffer. If something wrong happens to your urinary system, at your kidneys and urethra, urinary bladder, ureters, okay, if something wrong happens in your urinary system, your cardiovascular system has to bear the ill effects. Okay, so it's like that. So it goes both the ways. So far, is it clear to all? Next, coming to the symptoms of heart issues. These symptoms don't appear early on, but usually during the when the heart disease has reached a critical stage. Okay, usually during these stages, symptoms of heart diseases will come up. Okay, so chest pain, that is angina pectoris. Okay, that is also another name, angina or angina pectoris. So that is what we call as chest pain. Okay, it's very common in heart diseases. Chest pressure, there is a heaviness and discomfort around the chest. Okay, you can feel as if somebody has tied a tight belt around your chest. Okay, you can feel the weight of your chest, and whenever there is a chest pressure or heaviness or discomfort on your chest, you will definitely feel short of breath. Okay, you will find it difficult to breathe. That is dyspnea. Okay, not able to breathe properly. Shortness of breath is called dyspnea. Okay, then dizziness and fainting. When you are not able to breathe properly, you are hyperventilating, there are high chances the person will faint because you're not having enough oxygenation. You're not getting enough amount of oxygen supply because of the shortness of breath. Okay, so dizziness and fainting. Then fatigue and exhaustion. When your body does not have enough oxygenation, okay, you will not have the energy to do things. So definitely fatigue will set in. Fatigue and exhaustion, without even doing any physical activity, exhaustion will set in. Okay, these are the most major main symptoms of heart diseases. Okay. Symptoms of dengue will be there even when you have cured the situation of dengue, at least for the next 1 month. Some symptoms or few weeks, some symptoms of dengue will be there. Okay, it will take a month or so for a person who has suffered from dengue to completely revert back and come back to their best health. Okay, like lack of appetite, not feeling the taste of the food. Okay, tiredness. Okay, dehydration. These symptoms will linger even for few weeks after your platelet count has come up to be normal, when the platelet count has improved and improved, but still you will have some signs and symptoms lingering on for the next few weeks. Okay, but after that dengue will usually not have any substantial effect on your, in majority of the cases, major 90%, 99% of cases, dengue will not have any substantial effect on your health moving forward. Coming to the symptoms of blockages in blood vessels throughout your body. How can you identify that there could be some atherosclerosis or any other form of thrombus or blocks in your blood vessels? Okay, not just your arteries, but also your veins. So pain, cramps in your legs when you walk. Okay. Leg sores that are not healing properly. There are some wound in your leg which doesn't heal quickly. Okay. It takes time for your leg sores or leg wounds to heal. Cool or red colored skin on your legs. It appears cool, not yellow or green. It looks more cool toned because there's a lack of oxygenation. Okay. Swelling in your legs. Okay, which is persistent swelling in your legs, numbness in your face or a limb, and this may be just on one side of your body as well. Okay, difficulty with talking, seeing, or walking. This happens like when some effects of stroke. Okay, some symptoms of and stroke that is waiting to happen. Okay, some symptoms of a stroke that is waiting to happen. In that situation, you may have difficulty in talking, seeing, walking. Okay. So these are the certain symptoms for blockages in your heart, or sorry, blockages in your blood vessels. All these symptoms will not be same for everyone based on the type of cardiovascular diseases you are suffering from. Different form of symptoms will be seen. what conditions are cardiovascular diseases? Like what are the conditions you see? One is arrhythmia. Arrhythmia, as I mentioned earlier, the heart beats, the cardiac rhythm, okay, is abnormal. Okay, problem with your heart's electric conduction. Heart also has electric conduction because of which it contracts, relaxes. Okay, so when there is a problem in this electric conduction, you get arrhythmia. Okay, you get abnormal heart rhythms. So usually this is when you do a ECG, electrocardiograph. Okay, even in emergency it is done. Emergency department ECG can be done. So a general physician as well. Okay, they also know how to read a cardiac arrhythmia. Okay, so tachycardia means abnormal heartbeats more than normal. Okay, more than normal. Bradycardia less than normal heartbeats per minute. Okay, extrasystole, additional contraction. The heart has to contract and relax. In extrasystole, the heart will contract 2 times and then relax. Okay, so something like that. An extra time it is one more extra contraction the heart is taking. Okay, our atrial fibrillation. Okay, atrium is not contracting properly. Auricular flutter, ventricular flutter. Okay, these are auricles are also another name for atrium. Ventricles are the lower chambers. Okay, so when they have a flutter, okay, they are not contracting properly, or when they're relaxing, there is an additional vibration in the chambers. Okay, so these are our flutters. So these are the different types of arrhythmias. Okay, any general physician, you don't have to study this, just for your understanding. A general physician or doctors, they know how to read an ECG and understand what a patient is going through. Is it a cardiac emergency or not? Then we have valve disease. Valve disease means tightening in your leaking and tightening or leaking in your valves. Okay. These are the valves, as I mentioned. These valves separate your upper chambers of the heart to the with the lower chambers. Okay, it separates the atrium and the ventricles. Okay, so this is how a normal valve looks like when it is contracted, when it is in a contracted mode. Okay, and this is how the valves will open when the heart relaxes. Okay, so when the heart is contracting, the valves will close and the heart will pump the blood, empty the blood in the atrium into the blood vessels. Okay, but when the heart is relaxing, the heart valves will open. Okay, the valves will open like this, and the ventricles and the atrium, they will get filled up with blood for the next contraction. Okay, so this is how normally a heart valve should close and open. Okay, but if somebody is suffering from a congenital valve stenosis or valvular disease, congenital valvular disease, or an autoimmune disease in which your immunity, your lymphocytes and leukocytes are going and attacking the valves of the heart. Okay, it will destroy the walls of the heart. Okay, the edges become rigged. Okay, and it leads to either stenosis or in stenosis you can see neither the valve is closing properly or the valve is opening properly. Okay, both of these function the valve is not doing properly. Okay, so this is a valve disease. So valves are basically, they allow the blood to flow from one chamber, upper chamber, to lower chamber, atrium to ventricles. Okay. So is it clear, valve disease? Do you understand what a valve is and how these disease can affect? Next, we have coronary artery disease, problem with your heart's blood vessels, such as blockages. As I mentioned earlier, you can see here, these red vessels, okay, not the big vessels. These are the vena cavas and all, okay, not that. Aortas and vena cavas, not that. these small red vessels which you see, which is supplying blood to the heart. The blue vessels that you see, these are the veins. Okay, they take the deoxygenated blood away from the heart. Okay, so these red vessels, these are the coronary vessels, coronary arteries. Okay, these coronary arteries have a risk of getting stuck with fatty deposits. You can see here how a healthy artery looks like, inside of a healthy artery, how it looks like. Okay, slowly over a period of time, these atherosclerosis will not happen in a year or two. It takes years and years for an atherosclerosis to start from point ground zero to reach till here, near complete blockage. It takes years and years together. Okay. So you can see here initial fatty deposits, little bit of cholesterol, fatty lipids have gotten stuck to the interior of the heart arteries. Okay, slowly over time, your lifestyle has not changed, your diet has not changed, you still have high fatty diet, you have still not reduced the weight, you're still suffering from obesity. Okay, the risk factors, you are not modifying it at all. So slowly the fat deposits will keep on happening on the same place, at the same affected artery, till one day it is completely closed and there is no blood circulation that is happening. Blood is not able to reach the tissues. And if the blood is not able to reach the tissues of the heart, that area will undergo necrosis. It will undergo deoxygenation. It will start to slowly die off. Cells that don't get blood that don't get oxygen, so slowly they will start to die off. And that's how you get heart attacks. Okay. Heart failure, problem with the heart in pumping and relaxing. Usually it leads to fluid buildup, shortness of breath, so that is heart failure. The cardiac output, okay, is abnormal. That is heart failure. So here you can see the comparison in a normal situation. Normal volume of oxygenated blood is pumped to the body. Okay. But in heart failure, your heart does not have enough strength to pump this volume of blood to the body. Okay. So definitely it is pumping, it is contracting, but it does not have that strength, okay, that vigor in its contractions that it can pump a whole lot of volume of blood into the body. Okay. So that is heart failure. Next is the periphery artery disease. So periphery artery disease, periphery artery, arteries of your extremities, lower limbs. Okay. So issues with the blood vessels of your arms, legs, abdominal organs, okay, such as narrowing and blockages. Why do we call it periphery artery? These arteries are very far away from the heart, okay. Your abdominal region, your pelvic region, legs, okay, arms, ends of the arms, forearms, okay. These are the parts of your body very far away situated from the heart, okay. So definitely the vigor at which these arteries get the blood pressure will be low. So they are also at a higher risk of developing plaque. Okay, this plaque will not just happen in the coronary artery, okay, but they can also happen in the periphery artery. Okay. Then you have aortic disease, problem with the large blood vessels of the heart. So these are the big blood vessels. You can see they are thick, well-rounded and big, and they carry majority of the blood supply in your body. Okay, like your aorta, abdominal, descending aorta. Okay, aorta has different parts: ascending aorta, descending aorta. Okay, so the descending aorta, Okay, that leads to abdominal aorta, that gives blood supply to your stomach, your diaphragm, your lungs, your liver, your pancreas, your intestines, okay, your kidneys. Okay, majority of these organs get their blood supply from the descending aorta. Okay, so what the aorta can also have some issues. Okay, so you can see here how a normal aorta looks like and how a distended aorta will become. Distended blood vessel or distended artery, we call it as aneurysm. Okay, aneurysm, you can see the spelling here, aneurysm. So when there is an abnormal dilation, because how does this dilation take place? From a very long time, you're suffering from high blood pressure. What is high blood pressure? The pressure at which the heart is pumping blood into the blood vessels, that pressure is very high. Over a period of time, your vessels become very loose and weakened. Okay, when you hold, you can imagine, you take a polythene, and the polythene is holding a very heavy object. Okay, it is getting a polythene is getting a pressure from a very heavy object inside it. Okay, for a very long time you have hung it somewhere. Okay, after some time, the polythene, the place where it is getting the majority of the pressure, that area will start to thin out, and it will start dilating. It will start spreading out. Okay, the same technique happens in your aorta as well. Okay, when from a very long time you're suffering from hypertension, you're not treating it, you're not treating the root causes, you're not losing weight, no, you're not exercising, okay, you're not making some lifestyle changes, okay, modifications are not being made, your aorta will also undergo this distension, okay, because out of high blood pressure. Okay, and this distended part of the aorta is called aneurysm. It can burst. Okay, if it keeps on distending because of high blood pressure, one day it will burst. It will lead to internal hemorrhage, which could be fatal in nature. Okay, then you have congenital heart disease, heart issues that you are born with, which can affect different parts of your body. These kids will require uh, um, a surgery to be done, cardiac surgery to be done to correct the whatever septal disease or valvular disease they have. Septum, as I mentioned, see, valves are here. Okay, this white area. Okay, the white area you see on both the sides. The valves will separate the upper chamber of the heart. This is the atrium, right? Right atrium and left atrium. This is the right ventricle, left ventricle. Okay, so septum will separate the upper atrium from the lower chambers. Okay, the wall will separate the upper atrium with the lower chambers. But septum, you can see here, there is a separation here. Okay, that is separating your right side with the left side. This whole area is the right side, this whole area is the left side. Okay, so the septum divides your heart into right and left chambers. Okay, and sometimes the septum will have a hole. Okay, septum will have an abnormal opening. It should not be like this. Septum should be completely closed from top to bottom. Okay, but some kids are born with a hole here. Okay, a defect here, and because of which oxygenated blood and deoxygenated blood gets mixed up. Okay, so this is the congenital heart disease. Is it clear to all? Yeah, congenital heart disease happens when the fetus is getting developed, okay, within the womb. Also, if the mother's nutrition is not adequate, folic acid deficiency and all, if it is seen in the pregnant mother, it leads to some congenital heart diseases. Prenatal and preconceptional nutrition is important. Okay, some congenital diseases, it's not in your control. It can still happen even if you're a healthy woman, you had a healthy pregnancy, but still you can give birth to a child who has a congenital septal or disease or valvular disease. Okay. Then pericardial disease, problem with the lining of your heart, including pericarditis, pericardial effusion. So what is pericardium? Pericardium, you have to understand, you can see here, pericardium is a very thin sheath. Okay, it's a kind of a transparent sheath that covers your entire heart. Okay, it protects your entire heart. But sometimes some inflammation and infection can happen at the pericardium. Okay, and if any infection or inflammation is happening, it could lead to uh, heart diseases. Cardiac output will be impacted. The cardiac arrhythmias can take place. Okay, so here you can see pericarditis. So this is pericarditis. Okay. Pericardium is a very thin sheet that covers your entire heart, protects your entire heart. Sometimes pericardium will undergo infection or inflammation. Okay, it becomes pericarditis. Okay, and that could also affect the health of your heart. Cerebrovascular disease. Okay, since we are dealing with blood vessels here in this topic, so even the blood vessels that supply blood to your brains, they can also have aneurysm. Aneurysm, if you remember, we just now discussed arteries. Okay, arteries after a, a big fight with your high blood pressure. Okay, arteries for a very long time they're fighting with high blood pressure. Over a period of time, they get weakened, they get loosened, and they form aneurysm. And this aneurysm can actually happen anywhere. It can happen in your aorta, it can happen in the arteries, it can happen in the cerebrovascular system, that is arteries supplying blood to the brain. Okay, and then when it bursts open, you get hemorrhagic stroke. Okay, and sometimes it will not even burst open. Sometimes it is not an aneurysm, it is just a plaque formation. You can see here blockage in the blood vessels, and slowly the blockage will increase, and there is no blood supply to the brain tissue. And the brain tissue, which is not getting any more blood supply, will start dying off. The cells will start necrosis, it will start dying off. And that's how you get an ischemic stroke. In ischemic stroke, there is no bleeding, but there is an absence of blood supply to a particular area in your brain, and you get ischemic stroke. Okay. Hemorrhagic stroke, the blood vessels will rupture because of this blockage or aneurysm, and the blood will spill out. Okay. Hemorrhage. Both are fatal conditions if it is not treated within the golden hour of 1 hour. Both these strokes are fatal in nature. Okay. Then DVT, deep vein thrombosis. Coming to the veins, blockage in your veins or vessels that bring, what are veins? Veins are the blood vessels that bring blood back to the heart. Okay. They carry deoxygenated blood. Okay. They carry deoxygenated blood. So veins usually don't have enough of a blood pressure. Okay. And the veins, especially in your legs, your extremities, they have to fight against gravity because they have to bring the blood up. Veins have to bring the blood up. They have to fight against gravity. Okay. Sometimes what happens, a healthy vein will have a healthy blood flow going upwards. But in some cases, pooling of the blood happens inside the vein, because you can see here there are certain uh, septums here, okay, which can catch hold of blood cells. And sometimes the pooling of blood vessels happen here. And over a period of time, when the blood cells are not moving, it will form a blood clot here. Okay. And these blood clots, usually, if they stay in that one place, they are not that harmful. But problem is when they break off. When these blood clots, they break off, they cause this thrombus. You can see here this a broken off blood clot. Okay, a bundle of blood vessels which are clotted, they have broken off from here, and they travel through the blood vessels, and they can get stuck anywhere. Usually, if this thrombus is getting stuck in your lungs, within minutes the person can die. Okay, within minutes, the person can die because it is not providing oxygenation. It is blocking your oxygen exchange. Okay, so this is DVT, deep vein thrombosis. Yeah, varicose veins as well. So all the disease conditions, is it clear to all? These can be reversed. Treatments are there. Here, laser treatments are also there to reverse this situation. So what are the common tests you can do to diagnose any cardiovascular disease? Blood work, get your blood work done. See if you are suffering from high blood pressure or high cholesterol levels. Okay, what are the contents of your blood? Find that. Okay, blood sugar level, cholesterol level, protein in your blood. Okay, do all these tests. Find out the amount of platelets that you have, leukocytes you have, lymphocytes you have. Blood clotting issues can be checked. Ankle brachial index, okay, it is used to compare the blood pressure in your ankles and your arm. Okay, if the blood pressure at your in your usually when you do a blood pressure test, okay, when you do your blood pressure, check your blood pressure, your arms are used. Okay, but arteries are present everywhere in your body. Okay, so arteries present at the ankles, okay, a blood pressure of that is also checked. Blood pressure of your arteries is also of your arms are also checked. Comparison is done. If there is a huge difference, if there is a huge difference between your arm blood pressure and ankle blood pressure, it means you may be suffering from deep vein thrombosis. Okay, electrocardiogram, that is EKG, ECG, just to find out arrhythmias. Ambulatory monitoring, so this is done 24 to 48 hours of blood pressure monitoring. You go to the hospital, they will put you on a device. Okay, it's a handheld device, you just have to wear it 24/7. You should not remove it. Okay, they will put it on either on your ankle or they will put it on your wrist or your arm. Okay, and they will send you back to home. You have to go back to your home to your regular routine. This device should not be removed even while bathing, doing anything. This device should not be removed. Okay, then after 2 or 3 days you will go back to the hospital. They will remove the device and they will find out the data collected on your blood pressure. Okay, this device will give the data which time of the day you were suffering from high blood pressure. Okay, at what duration, how long you were had blood pressure, what was your blood pressure when you were resting or sleeping. Okay, so it gives a correct data. Okay, an average of what your blood pressure is like. Okay, this is ambulatory monitoring. Then echocardiogram, it's kind of a sound wave like ECG, USG, ultrasonography. Say very similar device is used, which sends sound wave to your heart to create the image of your heartbeat and blood flow. Okay, echocardiogram can be done for DVT as well to find where atherosclerosis is, where blockages are, where a thrombus is. Okay. One second. Then you have ultrasound that also uses sound waves to check UCG, USG, ultrasonography, to check the blood flow in your legs and neck to find out do you suffer from deep vein thrombosis or not. Okay. Cerebrocardial diseases can also be a lifestyle disease because your lifestyle will affect all your arteries in the same way. Okay. Cardiac computerized tomography, CT scan. Do a CT scan, okay, that will create 3D images of your heart, blood vessels, exactly show you where the blockages are or any swelling and all. MRI, okay, magnetic resonance imaging. Angiogram, CT angiogram, MR angiogram. If any hospitals have cath labs, angiogram, angiography, angioplasty, okay, these can be done. Stress test. So in stress test, you will be put on a treadmill, okay? ECG plugins will be done on you, okay? And you will have to work on a treadmill. You have to run on a treadmill till the time of exhaustion, okay? Till the time you're completely exhausted, completely tired, till that time you will be made to run on a treadmill to analyze how your heart is functioning when you are under extreme physical stress, okay? Then we have cardiac catheterization. Same, any hospital has a cath lab. They will insert a small tube either through your femoral artery or through your clavicle artery. A tube will be inserted with camera, okay, or with any angioplasty also can be done. Okay, this open heart surgery is not required for this. Just through your blood vessels, this tube will be inserted carefully. It will reach up to your heart and automatically, just like a laparoscopic version, a plasty can be done. Any correction can be done. Any pacemakers can be kept on your heart. Any suturing can be done. Cardiac balloon can be placed, can be pasted. Okay. Management and treatment. This is completely clinical, but lifestyle based. What you can incorporate: lifestyle changes like changing your diet, increasing your aerobic activity. If you smoke or use tobacco, quit smoking, quit tobacco, including vaping. Okay. Medications. Your healthcare providers may prescribe medications to help manage cardiovascular disease. And that is completely your cardiologist. Whoever is a cardiologist, they will prescribe based on your disease condition. We will not discuss on that. Procedures and surgeries. If medications are not enough, you will be directed to go for some, you will be advised to go for some surgeries, okay, to treat your disease. And usually it includes placing a stent in your heart or your leg arteries, okay, to take away the clot, to remove the clot. Minimally invasive surgeries through cath lab, cardiac catheterization lab, open heart surgeries in severe cases, okay, ablations, cardioversions can be done. Then cardiac rehabilitation. Just because your surgery has been done, it does not mean you are back to health. Your exercise will be monitored, your health should be monitored, your lifestyle should be monitored even after surgery, okay. Active surveillance has to be done over a period of time. Once you are a cardiac patient, once you have been affected by a cardiac disease, the health of your heart will be monitored as long as you live, okay. That is surveillance. Coming to the prevention, avoid all tobacco products, smoking, drinking, weeds, vaping, okay. Manage other health conditions as well. Like if you are diabetic, especially type 2 diabetes, you have high blood cholesterol, you have high blood pressure, manage it as soon as possible, because these disease conditions will definitely lead to a cardiovascular disease. Achieving and maintaining a healthy weight, okay. Stay within the BMI of 25 to 26, okay. 25 to 26, don't go more than that. Even if you're overweight, don't go more than 26. Eating a diet that is low in saturated fat and sodium. This will be advised by your cardiologist. Exercising at least 30 to 60 minutes per day on most of the days. Like even not on daily basis, at least 4 times a week or 5 times a week. If you are able to pull in a 30 minutes exercise or a 60 minutes exercise routine, that is more than enough. Reducing and managing your stress. If your life is very stressful, try to de-stress your life. So these are the lifestyle management that you can do. If you have any queries, let me know for today's session.